Hello, my name is Ricardo Kitamura. I am a postgraduate program in Medicine Biophotonic from Universidade 9 de Julho from Brazil, and my supervisor is Dr. Ana Carolina Rato Tempestini Orliana. We're going to present you our study from the efficacy of 8 and 16% of methyl aminolevulinate topic application followed by red light irradiation regime in the treatment of facial actinic keratosis, a randomized controlled clinical protocol. So, actinic keratosis is a common problem in the dermatologist's office. The lesion can be multifocal and unpredictable, with the possibility of progressing to squamous cell carcinoma and high risk of metastasis. The global prevalence varies to less than 10% of the individuals aged between 20 and 29 years and 80% for individuals aged between 60 and 69 years with white ethnicity who live in a low latitude countries closer to the equator line. Actinic keratosis is known as a precancerous lesion in situ, which range from small spots to raised lesions, hyperkeratotic lesions, like as we see in this picture, and presented on the histopathological examination as a proliferation of dysplastic keratinocytes, varying from degree of dysplasia in the epidermis, and is common in older people who have suffered prolonged sun exposure through their lives, and generally appears in the areas of sun exposure such as face, shoulders, scalp, upper limbs, and ears. And in the natural course of the lesion, around 20% of them have the potential to become malignant squamous cell carcinoma. The treatment of the actinic keratosis may include topical medications, chemical peels, laser therapy, phototherapy, PDT, surgery, chemical cauterization with chloroacetic acid, cryosurgery with liquid nitrogen. And the photodynamic therapy has shown promising results in actinic keratosis lesions due to high resolution capability and low side effects. Rationale of the study. The increase in the incidence of the lesion, the economic cost of the treatments, and the impact on quality of life lead to study new treatment protocols for the skin conditions. Objectives. The aim of this study is to compare the efficacy of topical application of 8 and 16% of methyl aminolevulinate mol, followed by red light irradiation in two therapeutic regimens of 1 and 3 hours in the treatment of facial actinic keratosis with 3 months of follow-up. Methods. Our sample size calculation would be 144 patients, 4 parallel groups of 36 patients, 10% will be added due to potential losses, power of 80%, confidence level of 95%, and the alpha of 5%. For calibration, we will be only one examiner who will be responsible for 5 assessments on actinic keratosis lesions on the face, which will not be part of the study. 3 assessments will be carried out per patient with 30 minutes of interval between them to check whether there is an intra-examiner agreement. He will be calibrated for the primary outcome. The researcher will be involved in the data assessment of the study. Inclusion criteria. Patients aged at least 40 years, skin phototypes 1, 2, or 3 on Fitzpatrick scale, skin lesions untreated, non-pigmented lesions, non-infiltrated lesions, diagnosed previously grade 1 thin lesions or 2 moderately thick lesions, localized on the skin of the face. Here we can see the clinical presentation of thin lesions and the histological correlation, and grade 2, and there is histological correlation. Exclusion criteria. Photosensitive disease such as systemic lupus erythematosus, dermatomyositis, porphyria, among others. History of exposure to arsenic, no allergy to mol or similar photosensitizing agents, abuse of psychoactive drugs, previous radiotherapy at the site of the lesion, intense staining at the time of the treatment, pregnant or nursing woman, local or systemic infection, immunosuppression state, uncontrolled chronic illness or emotional disturbance, and use of topicals like retinoid cyclooxygenase inhibitors, alpha-hydroxy acids, and recent use of systemic isotretinoin. Randomization. The information about the group randomization will be inserted into the envelopes by an external researcher. They will use a Microsoft Excel version 2021, 18 blocks with 8 patients designed with letters by A, B, C, and D groups, sealed opaque envelopes labeled with sequential numbers. So we'll select 144 patients with actinic keratosis lesions on the face who will undergo randomization and will be divided into 4 groups. Group number 1 is our control groups with 36 patients with MOL 16% and 3 hours of incubation. Group number 2, MOL 16%, 1 hour of incubation. Group number 3, MOL 8%, 3 hours of incubation. And group number 4, MOL 8% with 1 hour of incubation. All of them will have irradiation by lead 630 nanometers. Our 4 groups of the patients, day 0 where we will apply the treatment. Day 7, they will return into the office for review. Day 30, lesion count. Day 90, lesion count, 3 months. And day 180, lesion counts and the end of the protocol. For all patients of our study, we will first clean the skin with chlorhexidine 2%, and the lesions of grade 2, we will make a very light curettage of the lesions, and then apply a thin layer of MOL in every lesion of the treatment, and then we will apply a polyvinylic plastic film to perform occlusion on the asset, followed by a thin layer of aluminum foil, leaving the suggested occlusion time of the group that the patient belongs. And then we will perform the PDT with 630 nanometers lead. And here we have our dosimetric parameters with wavelength of 630 nanometers and radiant exposure of 37 joules per square centimeters, and our sensitizer will be the MOL. Only the researcher responsible for the application of the PDT will know which treatment was assigned to each patient. The researcher responsible for data collection, intervention, or treatment will be blinded. Patients will be blinded. Primary outcome. Our primary outcome will be the clinical resolution of the lesion and the correlation of the number of the lesion within the 30-day period. Our secondary outcomes include the overall improvement of the photo-damaged skin with actinic keratosis in the base time and 30 days, the side effects such as pain, erythema, edema, desquamation in the baseline after treatment, and the 7 and 30 days and 3 months, and the recurrence rate of the treated actinic keratosis during the 6 months of follow-up period. Our statistical analysis, the evaluations for the number of lesions at different time points and groups should be performed using a repeated measure design, adjusting for Poisson distribution, followed by walled multiple comparison test. So this is our protocol. If you have any question, let me know.